Hi, in today's video, we're going to talk about something called Visual Midline Shift. Now, before I go into talking about that, let's tell you how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, that's okay. Go to our website at visionforlifeworks.com. You can do several things there. If you're ready to take the next step, then it's advisable that you just click that schedule a consultation button. But if you're not ready for that step, that's okay. Read some of the information from our website or take the questionnaire. Now let's talk about visual midline shift. So it's very important to specify that this is a different condition than what's called midline shift. Midline shift is actually quite serious, and while visual midline shift is also serious, there's definitely a difference between the two. Midline shift would indicate that there's something going on in the brain serious, like a space occupying lesion or tumor, and it literally shifts the middle of the brain over to one side or the other. Visual midline shift then does not have to do with something quite as serious as a tumor or space occupying lesion. However, it is very serious because it can cause a lot of problems for people. Some of the things that people may experience if they are having visual midline shift is that they might find that they're walking into things and not adjusting or using their space wisely. So this would be, here's a door frame and the person's knocking into one side. Or they may find that they're always knocking into things as they walk around in their house if their space has shifted. Well, what does that actually look like? A super simple way to see if someone has visual midline shift is to have them do what's called a pencil push-up. This would be where they hold a pencil out away from their face and they bring it into their nose. They are actually asked to concentrate on the tip of the pen like they're converging or crossing their eyes to it. If they do have a visual midline shift, then what will occur is as they bring that in towards their nose, instead of them coming straight to the center of their nose with that pen, they might come over to the side or over to the opposite side or hit one side of the nose. It could be severely off or just minorly off, but that would be one way to tell if someone has a visual midline shift. Now, who can possibly have this? Well, it can occur in quite a few different types of patient populations. So some of the things that could be going on with them visually would be strabismus or an eye turn, amblyopia, binocular vision problems or dysfunction. It can occur in many other things. So someone who has recently lost vision, maybe had a stroke. Certainly a stroke would be a very significant one that we see this happen with often. And that's just because a lot of their visual space is disorganized after they've had their stroke. So these are some of the people or patients that we might see this in, but quite honestly, anyone who has any level of vision or binocular trouble could experience a visual midline shift. It may even affect how a person's driving in their lane. They may tend to drift towards one side or another. And people with reading might notice that they are tending to sit with the book off to one side, or they have a tendency to miss some information or start farther down than what they normally would have. These are all things that could be happening in a visual midline shift. Well, what do we do about it? So first, we're going to design a program specific towards what your individual diagnosis and needs are. So we're obviously, you know that we use a specialized technique. It's not just your traditional syntonics, but it's a highly specialized light or electrical stimulation that's applied to the brain to cause a specific effect. And so depending on what your visual condition is, we're going to use a protocol based upon that. This would be a protocol that I developed, so not necessarily something that you're just going to get down the street at any doctor's office. So if you are interested in connecting with us to see how we can help you with your visual midline shift, certainly feel free to reach out to us. Again, if you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com and you can schedule a consultation directly there. If you haven't done so already, make sure you like this video, subscribe to our channel, and as always, if you feel like this would be beneficial, maybe you have someone that you've driven with before and you're like, they're always leaning off to one side, maybe they need this, pass the video on to them. Thank you.